Some of the applied aspects related to the thyroid gland, hypothyroidism. It is caused by low levels of circulating thyroid hormones. Depending on the cause, it can be primary hypothyroidism or secondary hypothyroidism. Primary hypothyroidism is a disorder of thyroid gland, whereas secondary hypothyroidism, where it is uh, secondary to the disease of anterior pituitary or hypothalamus. It leads to myxedema in adults and cretinism in children. Cretinism. The cause for cretinism can be congenital absence of thyroid gland, or there can be genetic disorder or lack of B12. The symptoms of cretinism are they usually appear 1 to 3rd week after the birth. They appear idiotic, ugly, obese, and short child. Mental retardation is common in them, and all the milestones of development are delayed. The skeletal growth is more affected than soft tissue, so stunted body with a pot belly occurs. Tongue is larger, which is called as macroglossia, and protrude out of the mouth. Big tongue obstructs swallowing and breathing. Sexual development is affected. Skin is dry, coarse, and wrinkled. Hair is sparse and scanty. Temperature is subnormal in them. So this is how a cretin looks, where the musculoskeletal growth retards. There will be pot belly, frontal bossing, and the child is mentally retarded. Treatment is treatment of the neonate with cretinism at any time with adequate iodine or thyroxine returns normal physical growth. But unless the cretinism is treated within few weeks after birth, mental growth remains permanently retarded. Myxedema. The myxedema occurs in hypothyroidism in adults. General features of myxedema are tiredness, weight gain, intolerance to cold, mental sluggishness, poor memory, decreased BMR, lower body temperature, husky and slow voice, and hair are coarse and sparse, and they will have extreme sleep. Some of the cardiovascular disturbances are like adrenergic activity is decreased, causing bradycardia, atherosclerosis due to the increased cholesterol levels, and atherosclerosis increases the blood pressure. Some of the neuromuscular features like fatigue, stretch reflex reaction time is prolonged. Some dermatological features like where skin becomes dry, yellowish, that is keratonemia occurs since conversion of vitamin A require T3 and T4. There will be swelling of the face, puffiness under the eyes, and non-pitting type of edema. Reproductive manifestations will be usually menorrhagia and infertility, and there will be constipation and anemia as well. So these are some of the clinical features of myxedema, that is periorbital edema, dry skin, coarse hairs, and puffy face. Hyperthyroidism, its common cause are Graves' disease, toxic goiter, TSH secreting tumors from anterior pituitary, and mutations that causes activation of TSH receptors. Some of the symptoms of hyperthyroidism are there will be intolerance to the heat, increased sweating, weight loss, nervousness, muscle weakness, extreme fatigue but inability to sleep, diarrhea, tremors of hands, goiter, atrial fibrillation, tachycardia, and exophthalmos. Treatment for hyperthyroidism is usually surgical removal of the thyroid gland. Graves' disease is an autoimmune disease and is characterized by development of TSH receptors stimulating antibodies. These antibodies bind to TSH receptors and mimic TSH action, making the gland hyperactive. In Graves' disease, there is a marked stimulation of secretion of thyroid hormones and high circulating T4 and T3 levels. This will inhibit TSH secretion. Increased levels of thyroid hormones tend to cause increased formation of antibodies, and exophthalmos is often seen. Exophthalmos, Exophthalmos means protrusion of eyeballs. The cause of protruding eyes is edematous swelling of retroorbital tissues and degenerative changes in the extraocular muscles. Sometimes eyeball protrusion stretches the optic nerve enough to damage the vision. Due to the protrusion of the eyeball, the eyelids cannot be closed completely while blinking or sleep. So, constant exposure of eyeball to atmosphere causes dryness of cornea, leading to irritation and infection, finally resulting ulceration of the cornea. So this is diagram showing the exophthalmos, that is protrusion of the eyeball. Goiter. Goiter refers to any abnormal increase in the size of thyroid gland. Goiter does not denote functional state of the thyroid gland. It may be associated with euthyroid, hypothyroid, or hyperthyroidism. Any anti-thyroid substances that cause enlargement are called as goitrogens. Goitrogens decrease thyroid hormone synthesis, leading to feedback increase in the TSH secretion. TSH is responsible for the formation of hypertrophic thyroid gland, that is goiter. Goiter in hyperthyroidism is called as toxic goiter. And goiter in hypothyroidism are of two types: endemic colloid goiter, or it may be due to the deficiency of iodine, or it may be idiopathic non-toxic colloid goiter. Endemic colloid goiter, it is also called as iodine deficiency goiter, where intake of iodine is less than 10 micrograms per day. TSH is produced due to the feedback mechanism and stimulates thyroid cells to secrete tremendous amounts of thyroglobulin. Due to iodine deficiency, T3 and T4 production does not occur, and thyroglobulin remains as such and gets accumulated in the follicles of the gland, and this increases the size of the gland. Idiopathic non-toxic colloid goiter, enlargement of the thyroid gland, occurs even without iodine deficiency. Some of the causes are thyroiditis, abnormal enzyme system, goitrogen substances like propyl thiouracil present in the turnips, and